like the husband made them go, the wife go. Does it work even if you have this negative attitude?
No.
I wouldn't think
First
so.
of all, if I get the call from the wife saying my husband needs to smoke, I want to get him in there, when can you see him, I wouldn't take him.
Yeah.
Say, have him call me.
When he's ready?
Yeah, if he's ready. Yeah,
if
he
and
has,
when.
yeah. I need to talk to the client first. But I tell you, it's not like I'm giving it away, right? People have to make a commitment when they come in. I used to think that there'd be more of the casual-minded kind of checking it out on a whim kind of thing, or the people who want to lose 10 pounds for the big wedding coming up. But it's really been a steady flow of really serious-minded people who are ready to take control or a little desperate.
Yeah.
And I find that the desperate people are more successful because they're more motivated.
Yeah. Well, when I went home that night after I had the treatment, I called my brother up because he has restless leg syndrome, and he didn't answer. My sister-in-law answered, and I said to her, Carol, honest to God, we got to get John in here. Like, let me talk to him about this. And she said, oh, I'll just make the appointment for him. And I said, I'm not sure it works like that.
No.
And so I talked to my brother, and he was just, let me think about it. I don't know if this is for me. And you know, it worked so well for me just on one session with you, and I was saying, geez, I just wish you'd go. But you can't, like you said, you can't make somebody go.
No. I'll tell you, 85% of my clients are women.
Are they really?
The 15% of the guys who come have the same type of response, but there's just not as many of them. Men aren't as open-minded, I guess. I don't know.
They need a more feminine side or something.
Something. I don't know what it is. You know,
Yeah.
I've had some, big burly, the tough guys come in. They know they really need to be, free of whatever their problem is, and I wear them down. They have to be motivated to do it in the first place, but after a few sessions, they're puddles of relaxation.
Mm-hmm.
Yeah.
Mm-hmm. But I imagine you must have a lot of satisfaction in knowing you're helping
Enormously,
people.
enormous satisfaction. I worked for many years helping people like transition into the afterlife with hospice, and from like the ravages of smoking, for example.
Yeah.
And now to be able to get people off the butts and to take control of their lives, enormous. I also do a lot of pediatric hypnosis. I have referrals from pediatricians. Children do better with hypnosis than adults by
imagine.
far. They were in a half of a hypnotic trance most of the time anyway. To them, hypnosis is Disneyland. They think it's just so cool. And the defining moment with a pediatric case, she was 9 years old. She was 3 months diagnosed with irritable bowel syndrome, if you can believe that.
What age again? I'm sorry.
9 years.
9,
Yeah,
wow.
yeah. And tears when she came in, suffering with symptoms, referred by her doc, and first session, frown turned upside down, big smile, came back 2 weeks later, a visit to. We track all the symptoms. I rate everything on a scale of 1 to 10 every day. And the symptom numbers started at like an 8 or a 9. She came back 2 weeks later, the numbers were down to 6. She came back 2 weeks later, the numbers were down to like 3. And it was enormously successful to help kids overcome fear, the bullying that's going on in school. I see a lot of kids who would have great difficulty with that. So, yeah,
So
there's a lot of
it boosts
satisfaction.
their self-esteem, and in turn, it makes you feel
It's awesome.
good
It's
about
just awesome.
your profession.
And as as a sole proprietor, you're marketing, you're doing everything, and that's the toughest part of the gig is everything besides hypnosis. When you're able to sit down, and so I put in a lot of 12, 14, 15-hour days. Haven't felt like I've worked a full day yet because of the upside of sitting down. And I don't do groups. I can't stand them.
Oh, really?
Yeah. Well, and that's more lucrative, but maybe it's all those years in hospice making one-on-one connections with people. That's kind of where I feel most
Right.
comfortable. And I think as a result of those people skills developed in hospice, I'm able to help people with hypnosis maybe more productively, and it's just the best for me too. So it's a win-win.
So it must help being a nurse. a lot.
Communication skills, yeah. Listening.
Listening is
That's what
huge.
hospice taught me, to listen.
Yeah.
Just when you think it's time to start talking, you listen a little bit longer.
Yeah.
And you watch body language. People come in uptight, like you were, and
Very much so.
So I'm talking and listening and all that, but I'm
Yeah.
also watching for body language, and I see when the eyes start to go down to half mast, and the yawn. And I had one guy once who was so uptight, and I could just see it the second he walked in. So I realized I had to talk and listen for quite a while.
Right.
And then he still looked uptight. I said, Bill, let me just describe to you some of the things that I might say during a hypnosis session. You think that would be helpful to know it ahead of time? He goes, yeah. So I said, you know, Bill, sometimes what happens is when you start focusing on your breathing, you can pretend that you can actually inhale what you want, relaxation. So
Absolutely.
I'll talk to him, you know, and as I go through the session, I'll be suggesting things like that, and I'll be suggesting, you know, imagining that you're at the beach and you can hear the sound of the surf, and every wave helps you to kind of melt and soften, loosen, and relax. So then he's doing one of these, sliding off in the chair, and he caught himself, and he realized that he was going into trance, and he wanted to know if the session had already begun. He didn't know what was happening. He was so instantly relaxed just by hearing suggestions about relaxation. So it was pretty cool.
Now, do you get, I know you said you work with some physicians, you get some referrals from
yeah.
doctors, and what about hospitals? Do you ever go into hospitals and do hypnosis like with anesthesiologists?
I haven't
or-
yet. No, it's on my to-do list. You know, being a nurse, I thought it would be. If I was to pick the most frustrating part of the field, it's still getting more into those situations.
Yeah.
It's a very tight group. I do have my group of physicians. Some have been referring to me right from the beginning and have been consistent. And I have enough to keep me pleasantly occupied. But
Yeah.
it surprises me that in spite of the research, decades of scientific research done in this field, in spite of all that. And that's how I do my marketing. I present
Right.
them with information that they respect and understand. And
So they still need to be a little more open-minded.
they do.
Just like with alternative medicines, we
Mhm.
know they're not. When I worked at Leahy, because I'm a nurse as well, there was an anesthesiologist who incorporated his profession, and he was a hypnotist, and it kind of helped. And he described how his patients needed less anesthesia because of this.
There's research that backs it up.
I know.
There's one study on my site where they validated $1,200 per patient savings pre-surgical hypnosis versus non. On my show, I had I took part in a Chronicle TV show. They did it all in hypnosis, and one of their guests,
On
it was-
Chronicle?
yeah.
Oh.
I had Mary Richardson in hypnotic trance in
I
my
love
office.
Mary Richardson, yeah.
So they did a show all in hypnosis. I took part of that, and one of the other guests was Dr. Elvira Lang, who is a radiologist physician at Beth Israel, who did a research report on using hypnosis for diagnostic procedures, and it was published in the British medical journal Lancet. Groundbreaking research. And she came on the show. After we did Chronicle together, she came on the show and was talking about the struggles that she had to break through. So it's never
Maybe
boring.
they feel threatened, who knows? But I think I see some changes and shifts in the medical field. You know, I'm a Reiki practitioner, and I see it slowly coming into being, and, you know, doctors are a little more accepting of it, and nurses are getting CEUs for it and things
Yeah.
like that.
Yeah. The gastroenterologists are so frustrated with the IBS people that they seem to be a little bit more open to refer, because they have no idea what else to do, you know. So mainstream medicine is 25% effective for IBS. Hypnosis is 85% effective, reducing symptoms. So
Wow.
yeah, it's significant.
Now, your clientele, what are they mostly? What do they come in for? Is it just a variety?
Stress, I would say stress is number one, weight is number two, IBS. Smoking would be number three. And because I have so many GI docs, IBS is right in there too, but I don't think it's, it is as common. I mean, IBS it costs this country $6 billion a year,
Oh
so
my
it's a
gosh.
huge problem. So it's an epidemic. It's a very quiet epidemic because of the symptoms. People don't like to talk about it, you know. So.
Now, what about post-traumatic stress syndrome, like veterans or even kids that have been sexually abused and come to you as an adult? You work with that?
I definitely have seen abuse clients. And one of the great tools you can use with hypnosis is encapsulation. In hypnosis, you can have them imagine from a distance or like through a filter So they're not really feeling the trauma, but they're more objectively observing it. You can have them create like a symbol that represents the trauma that they experienced back in the day.
Mm-hmm.
But you suggest that they feel a little bit of the anxiety, let's say, just so that they know it's real. You suggest that it's there and they can feel a little bit, and they do. And then I have them imagine like a platform, and they create this image of the problem. And then during the session, I'll have them imagine above, there's a lever beside where they're sitting, and they pull a lever, which enables this big glass dome to lower down on top of the problem of the past. And as it gets closer and closer, you can start to feel relief grow and freedom grow. And then I start to count from 10 to 1, and each number you can feel more empowered, you know. And then when you hear it, when we get down to 1, imagine that you can hear it actually lock into place, and they hear it. I'm not making that sound, but they hear it. It locks into place. And then we pump up the exhilaration, freedom, and the power they feel for what they just did. Because you want to make them feel the stress and anxiety beforehand so that they really appreciate it when it goes away, because it always does. And then I have them, you know, turn their back on the problem of the past. It makes more sense to just encapsulate it because it's more doable. It's almost like too hard to imagine that you could make that problem go away, but if we just encapsulate it so that then they turn their back on it, walk out of the room, lock the door, and walk into the corridor filled with light and love and moving forward and start doing the imagery of the future and what it's going to be like. So
Well, this sounds amazing, like a real growing field, that's for sure. So how would somebody watching get in touch with you?
Oh, they can go to, they can go to burlingtonhypnosis.com. That's really all you need to do. There's tons of information. There's a lot of video clips from the TV show. They can shoot me an email. They can go to the website, shoot me an email, or call me and get a free session. I send out sample CDs to people who want to take it for a test drive before they actually want to come in and show face.
Yeah.
You know?
But just me, I'm so glad I did it.
Yeah,
and
I'm
get
glad,
over
yeah.
my
I thought it was really cool that you said you wanted to come and check it out first. It's all right.
Well,
She's
I
a
did, but
good
you know, I didn't,
journalistic reporter.
I didn't realize how much it was going to help me. It really, really made a difference for me in listening to
It's
the
the
tape.
ultimate reframe tool. You can change your perspective so quickly. People come in with enormous problems when we create the separation on the first visit.
Yes.
And then at subsequent visits, they come back in. They know the 3 Ps. They come in visit 2. They know me, the person. They know the place. They've been listening to the CD all week. They know the process.
And it's a very safe, nurturing place. That's what I felt when I walked right in. It was very nice. So.
Good. Yeah.
So good luck to you.
Thank you.
Good
Thank you
luck.
for having me on your show.
Yes,
This is very cool.
Yeah.
I inspired you to get this show started, didn't I?
Yes, you did.
Yes. I planted that seed with hypnosis.
There you go. Well, thanks, Paul.
Thank you, Kate.
Thanks,
Appreciate it.
everybody. Welcome. And goodbye from Table Talk.